Hi everybody, welcome to my live. Today we have a very special guest, someone who has matched at one of the finest internal medicine program in the US, Dr. Aniruddh Shah. I'm so excited to welcome him here for this live. Hi everybody. Hi. I'm great. How are you?
I'm good. Thanks for having me here.
Yep, I'm excited that you are here with us and sharing your story. So everybody, please welcome Dr. Aniruddh Shah. He has matched in Cleveland Clinic, one of the finest internal medicine program in the US. I'm very excited. He is here to share his story with all of us. Congratulations, first of all.
Thanks a lot, man. And I'm here to share my story, also mainly to answer some questions, because if I start my story, it's gonna take us all night. So let's not do that.
Yep. Okay. Okay, so tell me about yourself.
Okay, so important things. I went to a government college in Dhule, which is in Maharashtra. I started my med school in 2013. Now, that college is labeled as one of the peripheral colleges. What I mean is basically, I'm pretty much one of the first people to start from that college. No one in the near past had done the USMLE from there. So that gave me a ton of problems, mainly with documentation, just not having enough guidance, and a lot of stuff that I'll talk about later. But yeah, so I started my first year as anybody else. My first 2 years was just trying to survive, trying to get through med school. In my third year, I kind of started studying for step one, but it didn't really work for me because I wasn't as dedicated as I wanted to be. And till then, I didn't have like a very good reason to go. As I've heard before, that is a pretty bad reason to start USMLE. If the US is just like a fantasy. So in my final year, when I went for my clinical rotation, that's when I looked at residence. That's when I saw the way things work in the Indian hospitals, especially for internal medicine. And I realized that if I want to be trained in internal medicine, I want something better. And for me, US was an option till then. It was not till I went for my electives to the Cleveland Clinic. That's when I realized that, yeah, this is the kind of internal medicine training that I want. And that kind of is when I started my journey from. And then it was pretty much like anybody else. I gave my step one, I gave my CK, my CS, and then I just applied for I gave my application out. Then I went for my step three, came back, finished my interviews, and here I am.
Wow. But I looked at your timeline and it's pretty solid. No one would tell that you started preparing for USMLE so late. When did you start preparing for USMLE exactly, for step one specifically?
Yeah, so I would say I kind of started in third year, but then I gave up, and I have to say that I started afresh in internship. My step one was a little hurried. I gave it from this day I started my U, finished it in within 4 months. Could have probably taken a little bit more time, but I was still doing my internship and I wanted to get done with step one because I wanted to use that and apply for elective. So I did my step one bit somewhere. I started in June and I finished it in October. And immediately after that, I used that to apply for my electives. Went for my electives. That's where I gave my CS. If I thought my step one was hurried, my CS, because I studied for CS for about like 14 days, 15 days, and I came back and yeah, and then I studied for my CK and just finished it off. Sorry, Adil, I think I lost you there.
Hello. Can you hear me?
Yeah.
Hi, so during your MBBS, did you do anything to improve your CV? Or did it all begin from final year?
No, so I did try something. So at that time, since I didn't know much, what I knew was these three broad categories. One is research, one is volunteer, one is your step scores. So these are the three categories that I knew of. I knew that research was going to be a little difficult, so I focused more on volunteer activity. Now there are these things where you do, like, you join Rotaract Club, you join MSAI, they send you on these medical camps. That's where I started. Then there's one foundation that I just found by myself, and I just joined them. I helped them set up some camps. I can't say if it really helped me or my CV, but it did help me in the terms that I realized that, yeah, this is what I want to do, and it gave me that, jump start to, go ahead and build up my CV some more and just, stuff like that. My research, I did something in second year. I'm not very proud of it because I really didn't know what that was. I did like a lot of data crunching and number crunching, and I just got my name in, but I didn't know what I was doing. And when in my final year, when I actually did final year in my internship, I did do some original research. The reason I did it was not for my CV. I really wanted to learn how to do this because I was skeptical that if I go to the US and if somebody gives me a research project, what am I going to do? So I just wanted to learn how to do it, how to collect data, how to write like an abstract, everything from start to end. And that is the only reason I did some research. But if overall I have to talk about my CV, research was the part where I was lacking, and I still am. So that's hopefully something I'll have to build on during my residency.
Okay. So someone in the audience is asking for your credentials. Would you like to share them?
My credentials as in my scores?
Yep.
Okay, so I'm, so I got a 244 and a 259. I passed my CS on my first attempt, and my step 3, not exactly proud of it, but I got a 234. So I'll come to step 3 and all the mistakes I made in my step 3 later on.
Okay. Once you had decided that you wanted to give USMLE, why did you choose to do elective rotations first and then begin your USMLE preparation?
So my timeline went like, because at that time when I was researching electives, I realized that, so that's what people told me, that if you give your step 1, then you get more options for electives, which now I don't think is very true. I mean, you still get a lot of options without step 1 as well. But that's why I finished my step 1 in a very hurried manner, where I just gave it 3 months, did UWorld once and just finished it off, and I used that score to apply for electives. Now, I was studying for step 1. The reason I started studying for step 1 is because when I started USMLE, I realized that regardless of whether I match or not, the one thing that I love is studying for USMLE. If you gave me a book of NEET PG, and I had Pharmac Tech, the Pharmac NEET PG book, and I studied that for a while. I just did not like it, and I realized that I want to do more clinically oriented stuff. I want to read more. I want to read like a doctor now. So that's why I started step 1. Since I had already finished half of first aid, I had finished about half of UWorld. I realized that might as well just get done with it. Once I got done with it, and I got my score. Now the 2 places that I did apply to were Cleveland Clinic and NIH. NIH gave me a very, very prompt and sophisticated rejection. So after that, I was kind of waiting for a rejection from Cleveland Clinic, but I kind of got accepted. So I just went for it.
What did you do at Cleveland Clinic? Someone asked me, what magic trick did you pull off there?
Okay, so obviously no magic trick. It was probably in my entire USMLE journey, this was the luckiest I've ever gotten, getting an elective into Cleveland Clinic. But there's a funny thing that happened where I got into internal medicine and MICU. Those are the 2 rotations I got. There were about 25 people with me there. And they kept asking me, what did you do to get these 2 rotations? Because they're the most competitive and you don't normally get it. And turns out that all of the people who were there with me, they just thought that they won't get internal medicine and MICU. And so they just applied to gastro, they applied to vascular medicine, and they applied to all these different branches, thinking they just want an elective rather than, doing what they really want. And ignorance is probably bliss, because I didn't even know that this was a thing. I saw the list, I saw internal medicine and MICU, and I just applied for it. And I thought,
oh wow, that's amazing.
Yeah. So the electives, I mean, probably if I can say that I matched, it's because of the electives. regardless of whether I had matched in Cleveland Clinic or elsewhere. I think it's because of the electives, because of the LORs, and because of that confidence that it gives you. Because usually you start off, you go there, and it's new, right? You're traveling across continents, and it's a new place, it's a new hospital. My first day was in the MICU, and I had to present a case. And I think this is where your question, did I ever have trouble communicating, it comes in, because I never thought that I did have trouble communicating, but over there when you start presenting a case for the first time, I remember I just forgot how to English, and it was pretty scary, it was pretty nervy that time. But then the reason why electives go so well is because you work from day to night. They see that and they give you an LOR. And places like Cleveland Clinic, university hospitals usually tend to give you a very personalized LOR, because every attending knows that if they give you an LOR from there, you will probably match, because that LOR holds a lot of standing.
What did you do different to earn a strong LOR during your rotation?
Well, I can be very honest with you, but I had the option of getting 6 LORs, because I was getting 1 week rotations in MICU, so 4 rotations and 2 in IM, but I got only 4. And the reason I didn't get the 2 was because that was my first 2 weeks, and they straight up told me no, because I wasn't doing well. And I get that. I mean, I wasn't presenting, and more importantly, I felt like I was getting in their way. I was trying to ask every small thing, and I wasn't confident in my presentation. So in my 3rd week, that's what I realized, that it's all about confidence. You can't know everything. If you know everything, then you'll probably be an attending, right? So even if it is wrong, but I used to present it. I used to not back off. I used to take more cases. I used to present it. I didn't go back to my room till like 8 or 9 p.m. and everybody left at 4, because I sat there. When the night float team came in, once they finished their rounds, I would ask them questions. I would ask them what to do, because they are usually more free at night. So they would sit with me and they would teach me so much about how to present. It's not about the medical knowledge really, it's more of present. So I did that, and so in my third week it went so much better, and I realized that that's all they want. They just want us to work hard and just be confident, because they cannot take in a student who is underconfident, who doesn't believe in what he's saying, and you can't take him and expect कि हाँ residency में will teach him. You need them to have some sort of base, and if that base is not medical knowledge, then it has to be confidence. Just the fact that you take that initiative to go ahead, do your own physical examinations, take your patient's history, present a diagnosis, regardless of whether it's right or wrong. So I think that was what I did differently, was that I made a lot of blunders when it came to presentation. In my 3rd week, when I got a very good LOR, I made a lot of blunders. I made a lot of wrong diagnoses, but I always justified it with what I thought was right. And my attending said the same thing, that even if you're going wrong, at least you are taking the initiative that, so on Monday I had 1 patient, by Thursday I had 4. And he saw that I was taking on more and more patients. I was asking the other American resident, to give me his patients. So I did that, because I think that's something he really liked. That he's like, this is all you need to do to impress me. That's what the attendant told me that time.
Oh wow.
Yeah.
And during the interview, did they recognize you?
So the chief residents did, because I was working directly with him, and I think so. Cleveland Clinic was my first interview, and I was very nervous. I mean, you have to be out. Firstly, it's over Zoom, and it was my first interview, so I was pretty nervous. But it's so great to see some familiar faces, and they directly spoke to me. They said, you know what, just relax, it's going to be fine. And yeah, I think those things just got in line without me doing much. It just happened.
Oh wow. Wow. So apart from the Cleveland Clinic, which other rotations did you do?
I didn't, but that is something I do want to talk about, because I actually applied for 2 electives when I was in India, because somebody told me that 2 is enough. Now that I've come back and I've finished this journey, I realized that was a very wrong step, because you want to apply for more electives, like you did. You've done more electives, and the more electives you do, regardless of whether your scores are high or low, the more electives you do, that does factor in when you're called for an interview. because they want somebody who they want to train in medicine, but they don't want to train in like general aspects of the hospital, like using that Epic. The Epic is the electronic medical record system in Cleveland Clinic. So they have Epic. They have 2-3 in the US. So I think this is my theory that when an interviewer looks at you, they really don't want somebody who they have to bring in and teach somebody like how to use a computer, how to switch on their mobile computers, how to switch on the medical records, how to access data, how to access the patient's history from another hospital, like you have to import data, how to make calls to the so when you're discharging the patient, you have to make calls to the primary care physician saying that I'm leaving this patient. So these things are something that the interviewer and the attendees don't want to teach you, because this is something that just takes up their time. But they do love to teach somebody who's doing medicine. So when I always thought that there are a lot of postgraduate students who are applying for PG again in the US, right? So there are people who finish internal medicine and they're applying again. And I always thought that they would have a much superior ranking than I had. But that's not true, because I know so many people who've done their PG who didn't match. And the basic concept that I could derive out of that is that the doctors over there, the attendings and the program director, is not looking for somebody who knows everything. They want you there. They want fresh minds who they can train the way they want. So, I mean, this is also one of the points that I wanted to cover later on, that when people ask me, should we do PG here and then go? I just say, no, that's just not necessary. Because there are so many things about our post-graduation that they do not like. They do not like the fact that we are overburdened with patients, which leads to a slightly more careless, or I would say a hurried history taking, a hurried diagnosis, and just getting the patients discharged quickly. So there are things that they do not like about our post-graduation, and that is why program directors love it when you are a fresh mind, that you're young, and more importantly, you're thirsty for knowledge, and just you won't randomly leave the work hours, or be there on time. You will leave on time. You will attend all their educational lectures. You will present as many cases as you should. So I think that's what people are looking for, and that's what when people go for electives, this is the one thing I tell them, that you have to show them this, that you are that person who will really, who's thirsty for knowledge and everything that I just said.
Okay, so I wanted to ask, what kind of experience did you take after your MBBS? Because there was some gap in between you finishing graduation and till the match.
Okay, so after my, so the thing with, in India, when the medical system goes like, after final year, you have internship, right? And that is something which is kind of a bonus for us, not only in terms of clinical experience, but it also helps us really compensate for things here and there. And people in the US love it. They love the fact that we have so much hands-on clinical experience that they love listening. And a lot of interviewers used to love listening to my stories about my OBGY rotations and my surgical rotations, because that is so. After internship, I took like a 3-month gap where I went for electives. So I kind of missed my graduation, but I came back and I finished all those repeat electives. After that, I had about 4.5-5 months where I was just writing review articles online, and mainly I was using that time to study for CK. I said I studied for step 1 about 3 months, but I realized that was where I was lacking, and so I gave CK a good 4.5-5 months, and I could see that increase in my score because of that. So in just trying to finish my CK. As soon as I did my CK, then after at that time I think the pandemic broke out. So I worked in a government hospital for a month. Then I joined MSF, Doctors Without Borders, so which was probably the highlight of my entire CV.
Oh wow!
And then I was still working with them while I did my application. So I think that pretty much covers my timeline.
Amazing. So now we'll come to a somewhat a boring topic. How did you prepare for step 1, the resources, and what time did you spend preparing for it?
Yeah, so basically about the steps, right? I mean, we could talk about it all night, but if I had to concise it, I have like a couple of things which I always tell anybody who's giving steps. So the first thing is study material doesn't really matter, because eventually it's going to boil down to the same few things. It is going to boil down to a question bank, most probably UWorld. It will come down to first aid, and for step 1 especially, first aid, UWorld, and a couple of other resources which is up to people. I use Pathoma. I also use Sketchy Micro. Nothing other than that. So these are the things. And I finished Pathoma and Sketchy Micro in the very early days of my preparation. After that, I only focused on UWorld and First Aid. So if I had to advise someone, I would say these resources plus one additional resource for physiology, which is either BRS physiology or one other book that was, I mean, whatever is like because BRS physiology is the language is pretty easy. It's very concise, and the only time that I read it, like a couple of chapters, something which I did recommend to a lot of people. Other than that, the resources that I just mentioned. But mainly the important thing is for step one, because it's usually people's first step, what is important is to build up that stamina. What we don't realize when we are giving step one is exactly how long 9 hours is, like 8 hours. We think that because it's the exam day, we'll just make it through. It doesn't happen like that. Midway, maybe after 6 or 7 hours, your head aches. You just want to get it done with. In the starting first couple of hours, you probably are thinking about each option. You're thinking so hard to recollect everything. By the end of your 6 or 7 hours, you're just like making guesses. You're like, this might be true. So the more you practice, the more anybody sits down for 5 or 6 hours and they sit and they practice MCQs. They just practice not getting up, basically. They practice just focusing and concentrating for 5 to 6 hours. They are going to do so much better. So I knew somebody who was studying with me. What he did was he finished UWorld very quickly. He revised First Aid, and then in the last 10 days, he just did his UWorld once again, but he did it 8 hours every day. So he was aiming, he tried to finish about 3,000 questions in 10 days, and he used to sit for 8 hours just like an exam, and just take like 10-minute washroom breaks and one half-an-hour break in the middle. So that really built up his stamina, and I know that his NBMEs were going somewhere around 215 to 220, and his end score was 250. So I know that this stamina thing really helped him, and that's where I made a huge error, not working on the stamina.
Oh, okay. The way that you prepared for your steps, you said you rushed through all these steps. Usually, what people say is to take your time and get a good score, but you had a different approach, and still you had really high scores. So how did that happen?
It wasn't a different approach. I would just say it was a wrong approach because of the initial problem that I mentioned of no guidance. So when you don't have guidance, you don't know how much time it should take. You don't know, and you need an estimate, right? Now I have an estimate that UWorld takes about 2 months. It should take about 2 months. Then you need a month only to revise First Aid. Then you need about a month and a half at least to just revise everything you've done in the past 3 months. So you have to take about 4.5, 5 months for step one. That's what I realized now. That I didn't. But after my step one, I didn't make that same mistake with CK. I did my CK for 5 months, where I did UWorld twice. I did Mbbs a little bit in the middle. But I definitely understood that this is where I was lacking, preparation time.
Oh, wow. So how was step 3 for you?
Okay,
you gave it during your interview season, and a lot of people recommend reaching out to programs.
Before I talk about step 3, let me come back to one point that I wanted to make. If anyone's looking for a strong step score, and any step score, step 1 CK, one of the most important things to do is to make sure that you don't have a big gap between the steps. All the steps are related. Even step 2 CS was related, and I'm just gonna wait. Yeah. So all the steps are related to each other. So the one big thing you'll have to make sure is not to have a big gap between all the steps. The problem with my step 3 was that I finished my CK in February 2020, and I gave my step 3 in December 2020. So that 8-9 months gap was huge. I forgot everything that I read for step 2 CK, and because the interview season was going on, and because we were under so much stress, we just up all night waiting for emails and just waiting and just getting rejection after rejection. I like the stress of that. It totally blew me away that time. I could not manage to sit down and do UWorld for step 3. So I gave my step 3 into December 2020, but I can very honestly tell you that I started studying on December 1st, and I gave my exam on December 26th. So that was, I mean, I knew that I would pass. I had that confidence that I would pass, but I knew that I could not reach the score that I wanted to. You should be given after CK. I strongly recommend that after CK, if you take like about 2.5, 3 months, or not even 2.5, I would say just 2 months, you can finish CK. You can finish step 3, because step 3 is exactly CK with just a little bit more biostats.
Okay.
Yeah.
So what do you think helped you the most in this journey?
I think networking. By networking, I mean not making contacts as such. It's not just making contact, but it's just talking to people. Since I had a problem that I didn't have the right guidance, so when I came for my internship to Mumbai, I realized that I need to talk to more and more people. So the way it helped me was they give me the right information, because when I mean, out of 10 people, you're going to find 2 people who are going to give you right information, who are going to guide you properly. So I got that. Secondly, there are a lot of things I was skeptical about. So I was always skeptical about whether I'm doing something right or not. And then I saw that other people are doing the same thing. So it gives you that sense of calm that, yeah, everyone's in the same boat together. Especially when it came to electives, when it came to finances. I always thought I was spending way too much. And that is a conversation I was very uncomfortable to have with other people, because now you're talking in lakhs. USMLE is in lakhs. So when I started networking more, I found more people, and then we discussed finances. We discussed how much we are supposed to spend, how much we will spend later on. So networking is one of the most important things, and and my family as well, obviously.
Okay. Wow. So were there any red flags according to you on your resume?
So the thing about red flags is that I didn't have any red flags. When we talk about red flags, traditional red flags are basically failing CS, or being a very old graduate, or probably getting fired from a program and then reapplying. That is something which we would call as traditional red flags. I didn't have those, but there are subtle red flags that I did have in my CV before I joined Doctors Without Borders. That subtle red flag is basically, I would say, this is my own theory, but if you don't have something on your CV that pops out, if you do not have something on your CV that interests a person who just opened it, because most of the interviewers will not probably remember you from what they've read about your application before. They'll obviously reread your application in front of you, or just before your interview. So a subtle red flag is, I think, not having something that really interests them and something they want to talk about. So before I joined Doctors Without Borders, and that was a COVID experience, and that is why everybody wanted to talk about it. So if when people ask me how do you enhance the CV, my advice, every aspect, the categories that I spoke about, like a little bit volunteer, a little bit research, but you need something that you are passionate to talk about, that you have a lot of stories to tell about, and the interviewer is supposed to be kind of interested in it. If it's medical related like mine was, then that's awesome. Then you're really lucky. But there are people who have very interesting hobbies. Like if I know a person who was a paraglider and a skydiver. So any interviewer who sees this is going to ask you about it. And when they ask you something very specific about this, they will remember you. So later on, I don't know how they do the ranking thing. Nobody knows that. But at least if they are interviewing 200 people, you are at least one of those that they remember. So this is interview skills 101, I think, that you need to give them something to remember. And the more personal you are, the more they're going to remember you, rather than just talking about a research or talking about, something which everyone talks about. So you want to connect with them like that.
Okay. So regarding research, you said you learned manuscript writing and how to write a review article. Did you take a course, or did somebody teach you on this?
No, so there are courses. I found out much later on that I could have taken courses. There are some free courses as well, and there are some which you can pay and get it done. But what I did was I approached a pediatrics attending who I knew in India as well. So I knew that he loved to publish papers, and I just spoke to him, and he genuinely just gave me like a topic, and he told me start collecting data. And it was just a day-to-day learning, and I made a lot of mistakes there as well. But that's the way you learn. and you read a lot of papers, a lot of abstracts, and sense of the language that they use, the words that they use, and that's how you start writing basically. But
wow.
yeah, one thing which I still don't understand is biostats and mostly the statistics when it comes to research papers. So that is something I'm trying to learn.
Okay. So how important is mentorship to you?
I think mentorship is probably the reason why I'm here. I mean, I've matched into Cleveland because if I was doing this whole thing self, there are so many more mistakes which I would have made rather than this. So I think mentorship in the right way, in the terms that you don't need somebody to hold your hand, walk you through everything, but you need somebody to answer the right questions. The right questions are: what is the timeline? What am I looking for? What are my expectations? Uh, where can I hope to match? And what are the important things in my CV that I should enhance? So mentorship means you need somebody to tell you the mistakes they've made so that you don't make the same mistakes. That's pretty much it.
Right. Awesome.
So I hope you're doing that now.
Yep. Yeah. So tell me, how did you manage your finances?
Yeah. So as I mentioned, finances it was a little touchy subject because not everyone is asked some. It's an awkward and uncomfortable conversation. So if I could go back, I would definitely be a little more out there and ask people directly how much am I supposed to spend. But so I don't know if I can give you a right value because there are a lot of variables. But what I have come up with mentally is just a mental categorization of my finances, which I think has helped a couple of people who applied last year with me. So the first category was unavoidable, non-changeable expenses. So these include your UL subscription and your step scores and stuff like that, which you have to pay, and that cost is not going to vary. So that is one category. The second category is, I would say, unavoidable expenses, but something you may be able to manipulate. Now this comes down to electives. Now there are electives which are free, there are electives which are paid, right? So this is just one example. Sometimes you take a call that I want a better elective. Like I know that Emory gives you a very good elective for $4,000. Now if you go to Emory, you are probably going to a borderline Ivy League hospital. So you know that it is going to be very good, but it's $4,000. So that second category is where you can take a call whether or not you want to drink. So there are things like flight tickets. It's unavoidable. You have to fly there, but it's up to you how much you can save up to there. So it's not much, but there definitely could be some variations. But electives is something that you can definitely either save or spend depending on what you think. And the third category, I would say, is something which is totally up to you. It is avoidable, and it is something you can manipulate very easily. So I would say these will include when you go for electives, when you stay in the US, so your lifestyle, what you spend on food, how much you go out over there. So these things. So this is the third category. So these are the three categories that I think really helped me, and we know that in a broad sense you are going to spend a lot, but the best person to tell you how much you're going to spend is your senior from your senior or somebody in the same state. The reason I say this is because now I had an additional expense of paying off my bond to the government. So if you're in Maharashtra, then you have to do that. But if you're in other states, then you don't. So that is also something that people have to factor in.
Oh, you're right.
Yeah.
I only had to pay 1.5 lakhs, and my juniors have to pay 5 lakhs. So it varies not only from state to state, but year to year now.
And you can also choose to if you don't want to pay the bond, you can choose to do your MOship, the rural posting, the one that the government wants you to do. But if you are doing that, then you're saving on those 10 lakhs, but you're also you're not giving your entire time to USMLE. And now when people say that I can do both, they need a lot of dedication to do that, because you come home from a 6 hour, 8 hour duty, and then you have to sit and you have to study for probably 8 more hours. That is a big level of commitment, and so that is something which is avoidable. I mean, you can choose not to pay that 10 lakhs, but then that is up to you. So that is the second category that I was talking about.
Okay. So let's talk about your interview season. How was it?
Okay, so scary, nerve-wracking. I mean, you know how it goes, right? The day you submit your application, all you're doing is just staring at the phone and waiting for email, and then you get an email and it's a rejection. Then you get rejection after rejection. So it is pretty scary, but the things that help just handling your mental health, just making sure that you do not break down because the pressure is too much, right? So you want to make sure that you don't break down, and at least when you have an interview, you have to show them a very positive face, where you have to show them that no, I've had like tons of interviews. So I mean, it goes something like that. But talking about interviews, I think I did well in my interviews, mainly 2 or 3 reasons. One thing was that I had this notion in my head that I want to keep it. So what people need to realize is that USMLE interviews, it goes both ways. They also want you to like them, right? So the interviewer wants you to be more comfortable. If they ask you a question that makes you uncomfortable, then it makes 2 people uncomfortable in that situation. So they will not ask you something that they think you won't be able to answer. So you really want to just, I mean, obviously people say you have to relax and all, but it doesn't happen. What you want, I think what worked for me was just keeping the conversation away from medicine and keeping it more personal. It always worked, because when I started talking about the things in my CV, I would always relate it to a real life story that has happened to it. And that's when the interviewer was more and more interested in what I had to say. When they spoke about hobbies, I just didn't list them. I told them just one hobby which I really like, and I could talk about it. So I think that is what I did in all my interviews, and I think that is probably what worked for me.
Okay. At any part of the interview, did you think you were overly eager to show them how much you like them?
Yeah, I think constantly. I mean, with this huge smile on my face, and so I was so bouncy on the screen, and I was very prompt to answer all the questions. It did show some eagerness or desperation, what you want to call it, but I think that happens, and that's okay. I mean, if you're interested, if you like them, there's no issue not to. I mean, there's no reason why you don't want to tell them. You just don't want to answer a question without thinking. That's it. So it's fine.
Okay. So after the interviews, did you communicate with them in any way?
Oh yeah. So that was I think those are things which gave me like an internal struggle, because I used to talk to people about post-interview communications, about letter of interest during the season, and I think we spoke about it as well that time, whether you should or should not do it. And on the broad scheme of things, I honestly don't think it matters. Nothing ever matters. You can send as many emails as you want. You can thank them hundreds of times, but it's not going to make a difference unless and until they really like you. So I would say you should, because I know that I did. I mean, I sent some programs that I really liked. I sent them emails. I even sent them thank you emails after the interview. The thank you email was just because I was like, thank you for giving me an interview, man. Like, I was just so happy that thank you email just came out of me. But letter of interest for an interview was a dicey thing. Although I don't think it matters, but for somebody who's those 2 months when you're just sitting, waiting at home and not doing anything, you might as well send emails so that you feel this peace of mind.
Did you reach out to programs before the season, like before the deadline?
No, I didn't. And I don't think that I'm not sure if you are allowed to do it. Some Reddit page or some forum told me that these things are frowned upon. So I wasn't really sure if I should, and I didn't.
Oh, okay.
But I'm not sure about it. I think if you want to try it out, then you might as well.
Okay. So I have a few questions that my audience has, and one of them is, what do competitive programs look out for?
So before I submitted my application, right, even I think the two of us were discussing about community and university and competitive and like chill programs and all that, and what do programs look for. My working theory is that they all look for the same thing. I don't think that university programs look for research. They don't want that you need to have this kind of research to get into that program. The simple reason is they probably everything is the fact that whether they think they want to work with you as a resident or not. That is probably the only thing they're looking for. And if they find that, yeah, you are somebody I want to work with, if the residents vouch for you, if an attending vouches for you, so then I think that they would want you way more than somebody who's just done research. So if you ask me what are competitive programs looking for, I think they're looking for pretty much the same thing what community programs or non-competitive programs are looking for, and that is just, do we want to work with this guy? Especially you talk about internal medicine pediatrics. It involves 3 people in a team sitting in the same room together for 6 hours a day. So will they be able to tolerate you? Will they like working with you? That is probably all they want to know, and that trumps everything else, I would say.
Okay. The next is step 1 pass or fail doesn't matter.
So again, hasn't happened yet. Nobody knows, but I have a working theory there as well. This year, CS was cancelled, so the programs were informed not to look at CS attempts or pass and fail or anything like that. Usually, traditionally, what we've been hearing is that if you failed in CS once, then you probably will not get interviews because that's really frowned upon, like somebody who's failed CS. But this year, because AMMC just told them that, you know what, CS is not being considered, they didn't. And I know 2 people who did not clear CS on their first attempt, and they still got interviews. They got a lot of interviews, actually more than me. So if you use that analogy over here, then it probably means that that when AMMC just sends a guideline that do not use step 1 pass fail, step 1 score to compare to if because you have a candidate who has a step score and you have one person who only has a pass. So AMMC will probably tell them not to compare those two because that's like an unfair comparison. And I think it fair in the terms that if they've been told not to use it as a comparison, so I think that they will not. So giving step 1 before the pass fail thing, honestly, I'm not sure if that will really help. But it doesn't mean that you extend your timeline for no reason. You also have to get it done with. So, and obviously this will put more and more pressure on CK. I don't think it will make CK harder, but I think the score filter that programs apply, usually I think they probably want somebody who's done 10 points better on their step 1 in CK. But now that you don't have a score in step 1, they probably will have a benchmark, and CK scores usually do run higher than step 1. So they probably, I don't think the exam will be difficult, but I think they will scrutinize CK way more.
Okay. So the next question is, how did you network?
So when I talk about networking, I think I did a good job networking within India itself. As in, I found the right. So I found USMLE students. I found the right people who would guide me through this process. But if you talk about networking from here to the US, like sending emails and getting in touch with attendings who are doing research and somebody who might help you, I don't think I did that well. I know the people who got J1 research in Mayo or Yale, these people did a way better job networking because they send emails to the right people, or maybe they send just so many emails that it reached the right person. But I think that's what networking would be, where you sit in India or you sit in your home country and it's in the US. If you make the right contacts, they're probably going to vouch for you, and if you don't, then you're probably on your own.
Did you write?
Sorry, I didn't get you.
How many publications did you have while applying?
Publications. Okay, publications that I'm like super proud of, probably zero. But things that I've done, let's say I've put my effort in. I've had 2 research papers, and I've had like a few review articles. Review articles are easier to get and easier to write because you're probably just reviewing literature and just writing it in your own words in a very layman term. So I would say about 4 or 5 review articles and 2 research papers.
Oh, okay. Next, I have a few specific questions. Um, how to match with low scores?
Okay, so I mean, it's probably not a. I mean, it's just if you had a low score, firstly, you have to try harder. Now, harder in the terms of what? So I think you have to try and focus on not. It's just very vague to say that you have to build your CV up better. I think you have to do something very specific and very targeted. So I would say something like not even research. I would say firstly you put your effort in making a poster or making something and presenting it in the US, right? So if you've not been able to score well on your steps, you want to show them that if they take you as a resident, then you will do all the things that they expect a resident to do, right? So you might want to do more electives. Even tele-rotations help at this point of time. But you want to do like poster presentations, especially in the US. If you get a research, then that is amazing. Because research, in a traditional sense, people have said that research always covers up for your step scores. But talk about research. If that research is ongoing, then everybody would love to listen to you talk about that research in an interview. But then how do you get that interview? And that I think will only happen if you publish that research and in your CV you can input saying this publication done. So you want to finish your publications. You want to get it published. And yeah, so low scores. So you finish the step scores part. So now I'll probably give step 3 first. Right. Second thing is try and get a research. Okay, probably research in home country wouldn't matter as much. If you can get something in the US, that's much better. And things like poster presentation also do matter because poster is something you can make over here in the guidance of some attending, and you just have to make sure you apply to the right conferences in the US. And if you can just go there and publish, this is what an American resident told me once. That he said that he knew one person who she matched, I think, at university hospital later on. But that's what she did. Like she made like a bunch of posters, published it in conferences in the US, and that really stuck with the interviewer, saying that okay, you've really presented a lot of things in the conferences. So that helped her. So yeah.
Oh, wow. So next question is how to choose a program. How did you make a program list?
Okay, so this question probably is I'm not really apt to answer that because the entire interview season we had one motto which was beggars can't be choosers. So that's probably it. But no, on a serious note, I would say if I had more options, so then I would just go like I would probably choose the program in the terms of university over community. Okay, but that is just me. I also really care about the city that I end up in. I love Cleveland because I've been there, so I know the places. But if suppose there was Cleveland in Ohio, if there was Cleveland Clinic in Cleveland and there's Cleveland Clinic in New York, I would have probably gone to New York. So if you're asking me how do you make a program list, that boils down to what interviews you have. You don't ever want to make a list based off what your interviews went like. You don't want to think that my interview didn't go well, so I'm going to place this on the bottom. That doesn't go. It doesn't work that way. You just think about the place. A very good list in the sense that when you're giving your interviews, you probably realize that this is the program which is responding well to me. They have I think. I mean, I'm not sure how people really choose a program because usually people get about 10 interviews, and while you're giving the interviews, that list automatically forms itself.
No, did you use any service or did you make your list by yourself?
I made the list by myself, but for me the list was pretty obvious. I I had a very clear defined university programs, and then I had clearly defined the community programs. The reason I chose university over community is because the community programs weren't cities where I didn't have. So for me, it mattered that my relatives are there or not. So I had like good relative based cities, and I put that on top. But I didn't use a service, and nobody that I know did. What you do is you by the time that you finish your applications and interview season, you kind of realize what you're looking for. So if you do realize that no, I want a program that gives me research opportunities, then university is obviously on the top. But then I know a lot of people who do want a lot of hands-on, especially Indians. We like hands-on internal medicine. We want to we want to go into work every day, probably poke a few patients here and there. So you want hands-on activity. And I've seen people put university and put community on top because they want more hands-on.
Okay. So next is there any research position at the Cleveland Clinic, and did you try to find one?
I didn't know, but I don't think I don't know honestly. I know they have electives, they have observerships, but I'm not sure about research. But for research, I think the most commonly the common places that I know people go to are Yale and Mayo. And I think it's very simple in the terms that you just have to email the attendings. You look for the subspecialty that that you're interested in. You email the attendings and you just, I think you wait.
So what are the things that you would do differently if you had to start this journey again?
Probably finish my step 1 in third year MBBS for sure. Because internship year was very hectic for me. I gave step 1, I gave CS, I did my electives, and I came back and I put all my effort in CK, although I didn't finish it before internship. But it was very hectic, and I know I would have done better if I gave it in my third year. Second thing I would have done differently was for people about the finances, because I had a very rough estimate and I didn't dwell too much into it, but I think I should have. And I should have probably just in my head made sure that I have a very good plan of where I want to spend how much. I got lucky that my electives were kind of free, so that was just a stroke of luck. But other than that, there was a lot of other expenses that I didn't factor in when I started.
Oh. So we have a few questions here that people have asked right now. Okay, which one do you want to take? You just press on it.
Okay, so there are like a lot of comments from friends and family, so let's just ignore all that. How did you find the right people for networking? I think to find the right people, I probably found like 10 wrong people. So there's like a lot of firstly you start with a lot of WhatsApp groups. They help because people do post important information there. From there I started like just personal messaging some people, and then they turned out to be really helpful, and then we helped each other. So there's this funny thing where I was giving my step 1, the reason why I keep talking about all the problems that I was facing, the main problem I had was when I filled in my step 1 form and I sent it, they rejected it in the terms that they said the person who has signed, my dean, is not verified by the ECFMG. And I was so lost because I didn't know what this means. I didn't know whether I can solve this, and I had already spent 70,000 for that exam form. So I went on that WhatsApp group and I just posted this question. Nobody replied for like a week. After a week, some guy from college, he replied to me saying that I had the same problem and this is how you solve it. And the two of us became like really close friends because we had the same problem of verifying our deans and professors with ECFMG, then getting our exam forms accepted, then giving their exam without a lot of guidance. And so that guy really helped me out a lot, and then I helped him later during CK. But I also remember that when I gave my step 1, my score was delayed by 2 months because apparently when you give your step 1, from ECFMC, your college receives a verification form, which is a postal one-page thing, where the dean has to sign and send it back. Now, my college was, when I say really, it was so peripheral that the post doesn't reach my place, my college, and that post got lost like twice or thrice. That's why my score got delayed for 2 months. And again, I found another person through that WhatsApp group who helped me out a lot and who helped me out to solve this process. So if you ask me how did I find the right people for networking, this is how I did it. And so even the two of us, we kind of found each other because we were in this process together, and because we're pretty savvy at meeting new people, talking about the right things, and helping people out when it's needed, because we are all in the same boat. So I think, how did you get your electives at Cleveland? I just said it just stroke of good luck. There was nothing I did special. I filled out the form. I paid the application fees. I didn't hear from them for like 2 months, and one day I emailed the elective coordinator, and I asked her, do I have an answer yet? And then she just sent me an acceptance. So I don't know. That was it. Okay. What else? Externships and tele-rotation at Cleveland. I don't think so, but for tele-rotation, I think Rush University offers really good tele-rotations. I know a friend who's done that. They are obviously slightly on the more expensive side because they kind of charge you as an observership fees, because that's what you're doing. You're not presenting anything. You're just an observer watching them and probably presenting over the Zoom call. So they will charge you an observership fee, which would be run around, I think, 1,000, 1,200, maybe even more. And Rush University offers, and I think, if I remember correctly, a lot of people go through that USMLE Sarthi or some other firm which has links over there. Because tele-rotations, yet, I don't know if hospitals have started their own tele-rotation, and because I haven't heard anybody publicize that yet. So I think you have to go through these third parties and just get a tele-rotation there.
Why didn't you go to a third party?
I think, again, by the time I found out about USMLE Sarthi or any other third party, I had already finished my CK. And so when I talk about mentors, I found this one guy who was guiding me throughout, and he's been my light throughout this USMLE journey. So I didn't really need it. And as soon as I got done with my electives, I realized that most of the troublesome part was over. So I think that's when I realized that third party wasn't high on my priority list.
Oh.
Okay, so yeah, somebody said no electives after internship. So I mean, that's the thing. Obviously, you get electives after internship. So if you are still an intern, I would probably suggest that you try and just get that elective and get it done with, because hands-on really, really matters. I mean, obviously, if you're an observer, it's not like it's a problem. You will still be involved during patient rounds. As I had observers with me, they would stand there, and the attendings, everyone is pretty sweet in the sense that they want everybody to be involved. So they would still talk to the observers. They would ask them questions just to make sure that everyone's still a part of the group. And I know that observers do get letters. It's just not as strong as for the people who do hands-on, because the observer the letters cannot mention how well you do while presenting cases. So I think that's the biggest problem with observership. But if you don't have an option, then you have to do it. Then there's no question. At least you can go there and you can learn the system. You can see how the electronic medical record system works, which is probably the entire point of going there for rotation. That you have to learn their electronic medical record system. You have to learn how to talk to their patients. You have to learn how to use a pager, how to page the right consult. You have to learn how to make the right call. So even if you go as an observer because you didn't have a chance, I think that's fine. Other places that I got interviews, I'm sorry, but I don't think I can disclose that. While you go for interview season, I think we signed some contract or something, so I'm not sure if I can disclose it. what else?
There's also a question icon, and we have a lot of questions there as well.
Fine. So, good affordable elective rotations. I think, Advait, this is a question for you, I guess, because you know so much about electives now. You are definitely one to answer this. But one advice that I would give, because when I was there for electives in Cleveland, I had a lot of other applicants who were there as well, and they were from other countries. And one thing which I felt like Indians don't do enough is send those emails, just send out emails. So I know that this guy would just come back from his elective rotation every day and send out. What he would do is he would look at nearby cities, just Google that city's name and hospital, and find out that hospital administrative email, and just send an email to them saying that I am so and so applicant, and I want to find out if you take electives or observership. And I know this one person who got an elective at some place who start electives, and they brought him on free of cost. They even arranged for his accommodation. So, and that after this person, they started charging for electives. So you can definitely just, if you, obviously there are lists on the website, but if you want to take an initiative and be proactive, you can do this. You can find out random hospitals, try out their administrative emails, and just send an email. The worst is that they won't reply. So you can definitely send an email asking them for electives. And the thing with these smaller hospitals is that you are probably the only student over there. So they teach you, they judge you based on everything, like your dedication, your knowledge, and they give you really good personalized letters. So I think that's something we could do.
True. When I was starting to look for electives, I also thought that there is only one way I could get an elective by paying more and more to all of the companies or the different places. But it is really when you start emailing, when you reach out to people, they'll be happy to guide you. A few of them really would.
When should we email programs to express our interest? I think after the application, at least that's what I did. Once I submitted my application, I waited for a good 2-3 weeks, and then I started emailing that letter of interest thing. As Adil was talking about it before, I don't know if you can or should do it before you submit applications, because there are like a lot of guidelines and do's and don'ts and things which are frowned upon in this entire season and this entire journey. But this is what I did.
Okay.
Does it really matter if being a recent graduate? I think there's a interval kind of thing. They categorize as like less than 3 years, less than 5 years, or less than 7 years since you graduated medical school. So I think they do look at it because they probably want people who are fresh out of med school, only because you have more knowledge and you're like, it's just I mean, obviously you get out of med school and you probably remember more, but you're doing in those gap years, if you are working clinically, if you are doing a research project. So I know that people sometimes take about 3 years to do a research project, and then they match in very good places. That's not, I mean, it doesn't matter that time that they are old graduates, because they were still doing something clinically relevant. So I think it matters if you're a recent graduate, if you haven't been doing anything and if you can't explain the gap between them.
Okay.
How many? Oh yeah, that's a good question. How many months prior should one apply for university lectures? I would say like whenever it opens up. If they say if it opens up 9 months prior, then that's when you do it. It really does seem something like a first come first serve thing. Because it's very competitive, right? Electives are very competitive, and I think especially the free ones, because everyone wants to apply to those. So you want to apply as soon as possible, and don't annoy them. You wait for like 4 or 5 months or maybe 6 months, and then you start emailing them and asking them what happened.
If you had to choose between observership at Cleveland Clinic or externship, at a hospital which is not so known, or which is through an agency, which one would you choose?
I would say, firstly, I think through an agency, right? So those agencies send you to those private clinics and stuff. Uh, See, I know observership in Cleveland Clinic. I've seen because I've seen it, so I know it's amazing. They treat you like a part of the team. You will learn a lot. If you ask me, observerships else, very sure how much they want that student to be involved, because when I was there for electives, especially in my ICU, I had an observer with me, and they gave him they didn't give him the liberty to access the medical record system because he's not allowed to, but they always asked him questions. They kept him in the loop. They would ask his decision regarding the management of the patient. So at the end, he did get a letter. And although the letter didn't say that he did hands-on, but it did express what they thought of his medical knowledge. So Cleveland, I know, does observerships like this. But if there are places where I've heard that observerships the observers are just like kept on the fringes of the team. They might be asked a question once or twice. So is much better. You can, if you have your own ID to access a medical record system, use the patient's previous data to make notes about it and present it to someone. That trumps everything else.
Oh, wow. So I have a few questions in the questions here. Can you see it?
Oh yeah. How would things change if one is planning to match into surgical program?
Yeah.
See, I obviously no experience with surgical programs, but I had friends. I have one person I know who matched from India. I think he was from Nair or something. But the most important difference I would say between the two is the number of elective experiences. For surgical programs, you need hands-on elective experience. That is kind of like a must. High scores was always a myth. They said that step 1 and CK scores must be much higher, but I honestly feel like that was a myth, because I know somebody who didn't have high scores still matched into a program. The only problem with surgical programs is that you need to have that you need to realize that there is a chance that you might get the first year the prelim, but then you might not get the rest of the 2 3 years. So you might have to reapply after the first year. That is a very 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 real possibility. So I think work as hard as you can for the step scores, but research could matter, but elective experience is the most important thing that would change if you are applying for a surgical program.
Oh, okay. So okay. This one says, can IMGs match into Cleveland Clinic without having a rotation at Cleveland Clinic?
Okay, so I think this year we are about. So Cleveland Clinic, it's a very IMG friendly place, by the way. I mean, it's the. I know people sometimes don't think so, but there are a lot of IMGs in Cleveland Clinic. I've spoken to about. So we are 50 of us. I've spoken to about 20 till now, like face to face. All of us did have electives there. I think they would like it. They would really prefer if you have an elective, so that you know the hospital, you know the system. But never say no. I mean, who knows? You could, if they like you, then they like you. Then it doesn't matter. So that's the thing. If a program likes you, if an interviewer likes you, all these barriers that we think of, no electives, no research, these all are just crashed. There are no barriers anymore. If they like you, they will take you. But if obviously you would want an elective at Cleveland Clinic to make sure that you maximize your opportunity to match into that program.
But what about a myth that people have, that all these programs have a pre-interview rank list? Like even before the interview, they have a list prepared, and the interview can only bump you a few spots.
Yeah, I heard that a lot, obviously, during interview season, because we used to YouTube so many videos, and there were so many conspiracy theories here and there. And the thing is, at the end, I was talking to a friend of mine, a senior of mine, and I asked him straight up, "Do you think it's possible?" He said, "Does it really matter? Does it change anything that you are going to do?" And it doesn't. So we don't know. I don't know if it's true or not, but it did not change the way I approached an interview. It did not change the way I approached the application season and the entire season. So I think it's better not to think about all that.
Okay. What's an effective CV? Apart from research, what can you do to improve your CV?
Yeah, that's what I started with that. So, three or four broad categories that I knew of was like volunteer experience, research experience, your scores, and also your work experience. Like that would a work experience is a separate identity of itself. But effective CV, right? If you're talking about effective CV, I wouldn't say that you need to have all, but you need to have something, as I said, which pops out in the CV, right? I had my work experience during COVID, and I just stumbled onto that opportunity. I got it, but then there are people. I know somebody who's done research in Mayo, so now for him that was the shining star of the entire application season, and that's what he expressed again and again. Because most of the interviewers will want to give you a chance to talk rather than just continuously ask questions. So when they give you a chance to talk, you can mention whatever you want to talk about. And if somebody has a published research from Mayo, then they will obviously want to bring that forward. I got my work experience. Really, everyone has everything on their CV, but it's really more about how you present it during the interview, what you talk about, and sometimes it also happens that your hobby. So hobbies are actually a very important thing. I'm not saying fake anything in the hobby list, but think about it when you put it down. You want to talk about something that you really like, because you cannot put down a sport and then the interviewer turns out to be a fan of that sport, ask you questions and you don't know anything about it. So hobbies is actually interesting because most of the interviewers will want to ask you something which is the way they would frame it is like just tell me a hobby or just tell me something about yourself outside of the CV. So this is what comes out. Like this is the first thing you want to talk about. So you want to also focus on you as a person. You want to focus on your likes and your dislikes as well. So I think apart from medicine, this is also something you want to focus on during the interview season at least.
Okay. So I think this one is the last. Did having step 3 score help in matching to Cleveland Clinic?
No, I mean they didn't know that. So I had given my interview, and I think I informed them before the match result, but I don't. It doesn't feel like it would be important to them, or I actually right now I can't remember if I informed them before or after the match. So, but honestly, step 3 helps. According to me, step 3 will help in getting the interviews, like getting an interview call, rather than your rank. So rather than you on the rank order list. So I think if you can finish step 3, firstly, it's a big burden of yourself. Secondly, I think that programs, especially community programs, love it when you finish step 3. So you want to get it done with if you can.
Okay. What was your motivation with your entire journey? How do you keep yourself motivated along the way?
That's a tough question, but I think mainly, so my elder brother was a surgical resident in JJ, and I was an intern there, and I just saw how residency works, at least there, and the workload, and I wasn't very keen on the fact that there are less academic lectures as I would want it to be. So I knew that I had to do a PG somewhere, and it had to be either I would have done it in India as well, but I just saw that elective, right, my 2-month elective, and I always had this comparison between the two, and it was a very biased comparison because Cleveland Clinic as a hospital is amazing. So they have like the best of technology and they have like the best of everything. So I always compared that with what I've seen in my medical school and stuff. So although it was a very unfair comparison, but it stuck with me, and I think that's what kept me motivated.
Oh, thank you so much. What would you say to anyone who wants to start their USMLE journey today?
I think I would say it's a great decision, but so although I usually people started in their second and third year of medical school, so what I suggest to juniors is that uh, there is no possible way that a second or third year medical student will have the right motivation to go to the US because you haven't seen anything clinical as of yet. So what I would tell students is that take it one step at a time. What I tell everybody, just take it one step at a time. Focus on one thing. So if the first thing in your way is step one, just focus on that. Maybe you can always change your mind later on, right? But you always want to keep focusing on the next step ahead. So first is step one, then is your OET or whatever, then is your CK. You keep focusing on only the next step and keep networking, keep talking to other people so that you know that you're not in this journey alone. When people study for NEET, usually you join classes, usually you join libraries where you have like a ton of people studying together. But for USMLE, that's not the case. So you want to keep networking, you want to know that other people are struggling as well. So you want to do that. You want to network more. You want to like take the next step. And one thing is that it's kind of ironical, but for you, USMLE students have to study just as much as NEET. So you still have to give that 16 to 17 hours a day, if possible, for every step. You have to do that for like months on end, and you have to do it relentlessly. But then, because it's a 9-hour exam, you also have to learn how to, just relax. Because it's like 8-9 hours, you have to build up your stamina. You have to learn how to relax. Because if you are anxious in the beginning of the three hours, then you're going to probably get hypoglycemic, not have enough stamina to end the exam well. So you have to manage both. You have to study just as hard, but you have to make sure you don't take as much pressure as NEET PG students have to take. So there are like a couple of golden points there, but I think the most important thing is just take it one step at a time.
Wow, amazing. Thank you very much for sharing your story here. It's been a pleasure to have you, and I would also thank my audience. It wouldn't have been possible without you, Dr. Shah.
Yes, thanks.
Congratulations again.
Okay, best of luck for everything, and thank you everyone for joining us.